Namaskaram. I am Dr. Shinsi Kottarathil, an Ayurvedic doctor working at Ayur Bethania Ayurveda Hospital, Thrissur, Kerala. In today's video, I am going to talk about the best available integrated Ayurveda treatments for Parkinson's disease. Before going to the treatment aspect, let us know what is Parkinson's disease. In today's world, especially after the COVID pandemic, neuro cases are increasing rapidly. In our neuro OPD, many people are coming with Parkinson's disease. It's a slowly progressive neurodegenerative movement disorder which worsens over time. The first and common symptoms may be barely noticeable tremor or shaking of one hand or leg or jaw, which slowly affecting or progressing to the other part of the body. The other common symptoms are bradykinesia or slow movements and activities, muscle stiffness or rigidity, and trouble in balancing, which increases the risk of fall. The most common type is idiopathic Parkinson's disease, which usually starts around the age of 55 to 65 years. The second most common type is drug-induced Parkinsonism, that is caused by drugs which usually interferes with the dopamine transmission. Juvenile Parkinsonism is a very rare type and it usually starts at very young age, even before 21 years of age, and it is mostly genetic. Vascular Parkinsonism is a neurodegenerative condition caused by small stroke or infarcts in the brain which damages the neurons and mimics the symptoms of Parkinson's disease. You might have also heard about the terms like Parkinson plus syndrome or Parkinsonism, which denotes atypical Parkinson's disease along with some other group of neurodegenerative disorders like PSP, progressive supranuclear palsy, MSA, multiple system atrophy, CBD, corticobasal degeneration, DLBD, diffuse Lewy body disease, etc., which also has the same symptoms of Parkinson's disease but also have some other additional features. The cause of Parkinson's disease is unknown, but genetic and environmental factors plays a major role. Specific genetic changes are linked with the Parkinson's disease and it is very rare. In the environmental factors, exposure to certain chemicals or toxins, pesticides and herbicides increases the risk of Parkinson's disease. Parkinson's disease is associated with the depletion of dopamine in the brain. Dopamine is a neurotransmitter or a chemical messenger which helps in the smooth and coordinated muscle activities. In Parkinson's disease, the area which produces this dopamine, it is called substantia nigra. The neurons in this area, this substantia nigra, is getting damaged and which leads to a reduced production of dopamine and which in turn reduces the brain activity and causes irregular muscle activity or movement disorder and other symptoms of Parkinson's disease. Parkinson's disease usually affects male gender than females and it usually starts after the age of 50 years. But sometimes it affects young people also and it is called YOPD or young onset Parkinson's disease. When you have any of these symptoms of Parkinson's disease, it is better to consult a neurologist immediately to find out the exact condition and rule out other causes. There is no specific test to diagnose Parkinson's disease. An experienced doctor can diagnose it clinically through neurological examination. However, some tests like MRI or CT of brain, DAT scan and some blood tests are useful for the process of diagnosis. Now we will see the treatment aspects of Parkinson's disease. According to modern medicine, there is no cure for Parkinson's disease. They may give medicines, especially chemical dopamine replacement agents like levodopa or Syndopa plus, carbidopa, pramipexole, Parkin, etc. to control the symptoms. They may even suggest for surgery like DBS or deep brain stimulation. But all these medicines have lot of side effects. As time passes, the disease progresses and they don't have any other option other than increasing the dosage of these medicines. And finally, the patient will suffer from lot of side effects like nausea, dyskinesia or involuntary movements of face, neck, shoulders, hands or legs, sleepiness and tiredness, confusions, hallucinations and behavioral issues. On due course of time, patient will suffer due to the side effects of these medicines than the actual symptoms of Parkinson's disease. Here comes the importance of Ayurvedic treatments. In Ayurveda, Parkinson's disease is compared with Kambavada, which is caused due to the imbalance of Vada dosha. The vitiated Vada dosha can lead to the degeneration of brain cells and thus causes neurodegenerative disorders like Parkinson's disease. Our gastrointestinal tract or colon is considered as the main seat of Vada dosha, and for Kambavada patients, gut related gastrointestinal symptoms such as bloating, nausea, vomiting, chronic constipation, etc., can be seen priorly before starting the actual symptoms of Parkinson's disease. Even thousands of years ago, Ayurveda Acharyas has explained the importance of maintaining gut health in correcting the vitiated Vada dosha, and the primary treatment for Vada is Vasti Ayurvedic enema, and it is the most important Panchakarma treatment in which herbal medicines are administered through rectum. As there are a lot of nerve endings in the intestine, the absorption and subsequent actions of these given medicines will be more faster when administered through rectum. The main difference in the approach of treating Parkinson's disease in Ayurveda and modern medicine is Ayurveda focus mainly on the root cause of improving gut health and thereby correcting the vitiated Vada dosha and thus preventing the further progression of the disease by using natural herbal remedies. Whereas the modern medicine can offer only symptomatic relief through synthetic chemical medicines, which has a lot of adverse side effects. Now, modern medicine has also accepted the Ayurvedic theory of relation between gut-brain axis and Parkinson's disease. According to new research studies, Parkinson's disease originates in the gut before affecting central nervous system. There is a strong connection between gut health and Parkinson's disease, as gut dysbiosis can contribute to the development and progression of Parkinson's disease. Gut brain axis is a biochemical communication system between the gut and the brain. In Parkinson's disease patient, it is observed that their gut bacteria pattern is different from others. The risk of developing Parkinson's disease was 76% higher among those with damage to the lining of gastrointestinal tract. The microbiome of Parkinson patients tend to display pro-inflammatory markers and facilitate the absorption of toxins, leading to an accumulation of alpha-synuclein. It is a protein that plays a major role in the development of Parkinson's disease. These alpha-synuclein proteins misfold and forms clumps of proteins called Lewy bodies, and these proteins hold an important clue to the cause of Parkinson's disease. Parkinson patients also will have gastrointestinal symptoms like nausea, bloating, reduced bowel movements, and constipation. And in allopathic way of management, these symptoms are often under-recognized and challenging to manage. There comes the importance of Ayurvedic Panchakarma treatment called Vasti. Vasti can be used to treat all gut-related issues. It can heal the lining of GI tract and thereby improves the gut health. So, Vasti plays a major role in the treatment of Parkinson's disease as it can heal the GI tract and also nourishes the brain. In Bethania Ayurveda Hospital, we have arranged an integrated, holistic approach for Parkinson's disease management. Here we have included Ayurveda, physiotherapy, yoga, meditation, pranayama, acupuncture, pranic healing therapy, speech therapy, occupational therapy, etc. to treat the patients physically and mentally. Our main aim is to slow down or arrest the further progression of the disease and also to improve the quality of life. Treatment of Kambavada includes administration of both internal medicines and external therapies. We use many herbs like Kapikachu or Mucuna pruriens, which is a potent nervine tonic and a natural dopamine supplement which increases the dopamine level in the brain. Also Ashwagandha or Withania somnifera, which improves the brain functions. Some other Medhya drugs like Jyotishmati and Shankhapushpa are very good for rejuvenating the brain cells and also to repair the damages happened already. We use some other drugs like Gugulu, turmeric, Brahmi, etc. also for the management of Parkinson's disease. Coming to the external therapies, mainly we use Abhyanga, Swedana, Churnakiri, Podikiri, Elakiri, Navarakiri, Pirichil, etc. And coming to the Panchakarma treatments, mainly Vasti and Nasim plays a major role. The Murthni Thaila treatments like Shirodhara, Shiropiju, Talam, etc. are also found to be very effective in Parkinson treatment. Muscle stiffness and rigidity can be managed through physiotherapy also. They regularly use different machines and manual therapies, and they train the patients for daily activities. Also through yoga, we can manage stress in a successful way, and also we can give maximum positivity and confidence to the patients. We also use this natural therapies like acupuncture and pranic healing therapy to give maximum confidence to the patients. For advanced cases, we also use speech therapy, occupational therapy, etc. So, all these systems together, our holistic approach is found to be very effective in controlling Parkinson's disease by arresting the further progression and also by improving the current quality of life up to a great extent. Through our integrated treatment protocol, we have observed reduction in tremors, increased circulation, ability to do daily activities with ease, increased mobility and flexibility, reduced dependency on pain medication. Thus, in general, quality of life is improved. Though there is no cure for Parkinson's disease in any system of medicine, with our personalized treatment protocol, with proper follow up and lifestyle modification by a healthy diet and yoga, meditation, pranayama practice, we can control the symptoms up to a great extent. The quality of life is almost restored, and our patients are found to be easily engaging in all activities which they found to be impossible before. I hope this video is useful, and if you need any further information, please feel free to contact me in this given number. Thank you and namaste.